Hi, my name is Heather Zylstra, and I will be presenting progeria syndrome for biology. Progeria is also known as Hutchinson-Gilford syndrome, very rare and sporadic disease. It affects the kidneys, brain, adrenal glands, liver, testes, heart, essentially all parts of the body. The brain, although it's affected, it does not affect the intelligence level of the people um, that are affected by progeria. The life expectancy rate is lifespan is 13 and a half years. And so far, no AI is available to assess risk because it is a random mutation. Etiology for progeria, it is a single gene mutation. The gene lemon A makes a protein necessary for holding the nucleus of a cell together. Mutation of this gene causes an abnormal form of the laminin A protein called progerin to be produced. This leads to unstable cells, wobbly nucleuses, and causes the aging process. This differs from many mutations in the sense that it is uncommon to pass down in families. Typically, it's a chance occurrence, and it's not inherited. This is called an autosomal dominant disease. So on the bottom here, if there's a picture, what it's showing is how a normal splicing of laminin would look. And on the bottom, there's the mutation that someone with progeria would have, and there's a missplicing. And you can see that the progerin, it looks different from the laminin, and that's what causes progerin to happen, or HGPS. So it affects 1 in 20 million. It affects people worldwide from Argentina to Egypt to Japan to Russia, the US, Canada, Mexico, everywhere. The picture above is not a current picture, it's from 2014, but it's just there to show you how widespread it is in the world. It's not prevalent in a certain gender, ethnicity, location. And right now there's 196 cases spread across 49 different countries. So they haven't found any correlation between where someone lives and the disease itself. Anatomy. For anatomy, well, like I said earlier, it affects virtually every system in the body. Bones are affected. The skull is irregular in shape and size. And there's actually a picture of that later in this presentation. Vision and hearing have to be tested because of the decreased function. Teeth are crowded because of the misshapen jaw. Little to no hair growth, skin, fat, muscle tone, kidneys, brain, liver, heart, everything is affected. But what's most affected in these people with progeria are the arteries, the blood vessels. They harden, and that's potentially what leads to their death of either a heart attack or a stroke. Okay, so the first symptom seen is in the first year of life, and it's slow growth. Okay, so this picture to the left, I'm not sure exactly how old this person is. However, you can kind of see from the picture in their appearance, they tend to look like an older individual, even though their growth, height, weight, in their development physically is not to par with other people their age. So they're smaller, but their appearance is older. So it's really hard to tell how old they are. So for the symptoms for appearance, we have slowed growth, below average height and weight, like I mentioned, narrow face, small lower jaw, thin lips, beaked nose, head disproportionately larger than the face, prominent eyes, incomplete closure of the eyelids, hair loss, even in their eyelashes and eyebrows, thin, spotted, wrinkly skin, visible veins, and typically a high-pitched voice. So they have severe progressive heart and blood vessel disease. Skin hardens and tightens on the trunk of their bodies, extremities, delayed and abnormal tooth formation. They experience hearing loss, loss of fat and muscle mass, severe hardening of arteries, restricted blood flow, and they tend to die from complications related to atherosclerosis, which is the hardening of their blood vessels, and it leads to heart attack or stroke. And although there's medications to treat it, there isn't any cure for it. Diagnosis. Okay, so it's a little out of order. Before anything, they would have to suspect from signs and symptoms that there's even a chance progeria would occur. So along with the signs and symptoms, once they have that, then they would start measuring height, weight, head circumference. And to the right, you have kind of an idea of what they would be showing you. So if you look at the weight and height, which is A and B, you'll see that the average height and weight is a lot higher than what somebody with progeria would have. They tend to, run lower on the scale. But if you look at head circumference, even though they're lower, they're still on like what a typical person their age would have. So their head circumference is average, but their height and weight is very low compared to others. So they would measure their height, weight, and head circumference, plotting the measurements on a growth chart. And they would also test their vision and hearing. As well as that, once they have concluded, like, okay, they, these measurements are adding up to progeria, they have signs and symptoms, then they would run a genetic test for laminate mutation to confirm that that's what they're experiencing. But as you've seen in previous slides, the people that have progeria have very distinct features, but that is one type of progeria, which is the most common one. Treatment. For treatment, there is no cure, only management of the condition. So they start by monitoring heart and blood vessels, height, weight, dental, vision, hearing, make sure everything's okay, treat it as it declines. They provide therapy, physical and occupational for these patients. They tend to have a lot of pain, a lot of stiff joints. So the physical and occupational therapy tends to help with that. Medications. So. Aspirin is given because it is a low level blood thinner, and it helps because they have thickened arteries and blood vessels. So the side effects of that are rash, ulcer, upset stomach, headache, drowsiness, heartburn, cramping. Another medication they might receive is statins. So a statin is a cholesterol lowering drug that helps reduce illness for people at risk or experiencing cardiovascular disease. So it helps them, again, because of their hardened arteries. And the side effects are headaches, dizziness, weakness, fatigue, digestive issues, muscle pain, low platelet count. Blood pressure medication is often given to lower their blood pressure. It reduces risk of heart attack, heart disease, and stroke by controlling the pressure of the blood that is circulating in their body. The side effects are diarrhea, constipation, low blood pressure, and headaches. Anticoagulants are blood thinners. So it thins their blood, making it easier for that blood to pass through these hardened arteries and blood vessels. The side effects are bleeding, bruising, and heavy periods. Anti-seizure. Okay, so anti-seizures are typically given for seizures to prevent them from happening. However, they can also be given to help control pain caused by damaged nerves, which there is no correlation between progeria and seizures. And so a lot of times I think these are given because of the pain. There was no connection between progeria and seizures, as I previously stated. And so that would be the only reason why it's given. The side effects are nausea, vomiting, dizziness, headaches, fatigue. And the next medication they may receive is pain medication, which, if you look at just the medication alone that they're receiving, a common side effect is headaches. And for a person with progeria, they're going to experience a lot of pain, headaches, joint pain, you know, everything that they have going on because of this nucleus, this, I'm sorry, because of this mutation that causes their nucleus to be unstable. It causes a lot of pain in a lot of different areas. So this is just kind of an overall medication. Anything that they experience that's painful, obviously you want to treat them. They don't tend to live a long, long life. And so preventing pain and increasing quality of life is very important. Side effects include nausea, vomiting, drowsiness, dizziness, constipation, dependence. And lastly, we have farnesyltransferase inhibitors, which are relatively new. So there's not a ton of research on it, but they're still, they've actually released it to be given to patients with progeria. It was initially developed for cancer patients, but it was found to help with weight gain and increased flexibility of blood vessels. So again, a lot of times they pass away from experiencing heart attacks, strokes. So enabling those blood vessels to expand could increase their lifespan. However, there's, again, not a lot of research done. It's relatively new, so it's hard to say how long it would increase their lifespan. Artificial intelligence. Okay, so CRISPR is a gene editor, and they've developed a similar one that has really helped with progeria a lot. They use this gene editing technology to increase the lifespan. These mice that have experienced this gene editor, you can see the untreated, not only are they a lot smaller in weight, but size in general. The one on the left, not only does he, is he a heavier weight, but he just looks healthier overall. It has increased their lifespan by 25%. They use a virus to deliver a genetic sequence called a guide RNA that guides a repair to the mutated gene. These mice live longer, look healthier, and they have a better weight. It isn't ready for humans yet. It's still in the process of perfecting this treatment. They're still in trials and trying to get it right so that there's not a lot of unwanted side effects from this. But, people with progeria, they have a relatively short and painful life. And I think it's really important that we put a lot of research into this syndrome specifically. We're a long way of curing them. But hopefully soon there will be more effective treatment for this painful, deadly disease. And maybe in the future, not too long from now, instead of just being able to treat the symptoms, we'll be able to cure the disease. And that's the goal. Thank you very much. Thank you for watching. I hope you learned something new. Thank you.